Hello, my name is Phil and I'm filming this as a testimonial and a thank you and also to let some people know what to expect following a total hip replacement procedure that I underwent a couple of days ago. So my procedure took place on the 16th of December 2023. And my surgeon was Mr Vipin Asopa, who, as far as I can tell, has performed an absolute miracle, although I accept I'm in the early stages yet. Prior to the sort of procedure, my hip had been deteriorating for a good 10 years and I was in quite a bit of pain. I couldn't walk very well. And the x-ray was showing quite a bad deterioration as well. This procedure was in my left hip where the deterioration was particularly bad. So I spoke to Mr Asopa beforehand and he recommended a posterior approach, total hip replacement utilising something called a symbios hip replacement or hip joint fitment. So that's what I've had. I was quite amazed that I was able to walk the same day as the operation, and I've made a few clips of me walking the day after as well, and sitting up and getting up and down from chairs and doing the dishes and things. But so that was all filmed the next day. But on the actual day of the operation I was able to walk, and I eventually came home in the evening of the operation as well, so I was really pleased with that. I had some really good people working in the team with Mr Asopa as well. So the procedure was done by HCA Healthcare at London Bridge Hospital, and the team sort of included the anaesthetist was someone called Dr Stuart Marshall, who gave an anaesthetic to sort of my lower half of my body, but my upper half I was just sedated, so I was unconscious. So when I came around I felt pretty good. I didn't feel groggy and really sick or like I've had for general anaesthetics in the past. So thank you to him. The physio saw me just not long after the procedure, a few hours after the procedure. She was called Anu. I'm afraid I didn't get her surname, but she showed me some exercises to go through, how to get up and down out of chairs and so on, and was very professional and lots of empathy. And I was treated by two main nurses there. One was called Karen and one was called Juliana. And again, apologies, I didn't get their surnames, but thank you to them too. So yeah, I really do feel, even though it's early days, yeah, the difference between how I felt before and how I feel now is quite marked. And I really do look forward to trying to recover this as well as I can and go as far as I can. So once again, thank you to Mr Vipin Asopa. It was really, as far as I can tell, a great job, and it's already sort of making a difference to my level of pain. I can sleep for a whole night, which I haven't been able to do for a long time. So thank you very much. So it's now been 9 weeks since my procedure, and so this is just a quick update to say how it's going, and I also wanted to talk a bit about how it felt to actually go through a hip replacement procedure. So at the minute, after 9 weeks, I actually feel my walking is almost back to normal now. I walked the day before yesterday. I did an hour and a half walk, but felt I could have gone further. And this is up and down hills and things, so it's not sort of an easy walk, and I'm actually walking with quite a long stride and just feel like I'm walking like normal. I also yesterday went to the gym and can use quite a few of the machines there. I don't have any discomfort with it. There's a few things where I'm still a bit limited in the range of motion that I've got, but I'm doing some physio exercises and some stretching to keep going further with that, and I do feel that I'm making progress in that area. And also I can't fully bend, so I can sit on the say the bottom step of my stairs, for example, but can't quite fully bend to tie my shoelaces comfortably. I can actually managed to tie them, but it still feels a bit tight, and like there's a bit more work to do in recovering that kind of movement. But like I said earlier on, it's only 9 weeks at the minute, so I can feel that I am making progress in those areas all of the time. So far it's a total success, and I'm feeling really good. Also about how it felt during the procedure, and what my feelings were around it. To start with, before the procedure, my osteoarthritis had significantly impaired the quality of life, really. So the activities I'd enjoyed, a lot of them I'd given up. I always used to enjoy going out and walking around, but I was actually doing everything I could to avoid going out and walking around. The months coming up to the operation, I even started to have foreboding every time I had to go up and down the stairs. If I needed to carry something, it was a pain. It became harder and harder to go to the gym, which is something I used to enjoy. So, it was really impairing my quality of life. And then when I went to first see Mr Asopa, I actually made the decision that I was going to go for it and just go for the hip replacement. And the minute I made the decision, I actually felt quite emotional. I think it's because I had resisted it for about 10 years for some reason. And yeah, at that moment I felt emotional. And then, we planned a date for the operation, and, I was getting sort of fairly stressed about it as it was coming up, because it's fairly significant procedure. On the day of the operation, I was fairly stressed, but everyone at London Bridge Hospital, they all did as much as they could to put me at ease. So I met Mr Asopa in the morning before the operation. I met the anaesthetists team before the operation, and the nursing staff and everyone. They were all sort of very kind and knew that I was stressed, and were trying to put me at ease, I think. As I went into the operation, I had to have sort of pain-killing medication and whatever, and before you knew it, I was sort of waking up after the procedure. After the procedure, I was obviously on quite heavy painkillers and whatever had been used to sedate me, so I felt no pain. I just felt really good. I tried to lift my legs straight away and was sort of told by the nurse watching me to not do that, but I could feel like I could lift it, and sort of almost easier than before, to be honest. And within a couple of hours, maybe within an hour, a physio came after I'd been taken back to my bed, my sort of room. Came, and physio came, and we started walking, and with crutches. And I have to say, I just felt that it was just really, really good. At that point in time, it felt like the day before the procedure I'd been a disabled person with reduced mobility, and now I just felt like I was no longer disabled, but I just needed rehab to build up my strength again. It really was light and day. It just felt like I'd gone from being disabled to being able-bodied again, and just needed to build up the strength. Physically, I didn't really feel pain, but like I said, I was on painkillers and so on, and then I was sent home with pain-killing medication as well. Some of it was quite strong, so the strongest was OxyContin, but I only took that for a few days after returning home. And after about a week, I'd also given up on taking paracetamol and ibuprofen. I didn't need it anymore. So after about a week, I wasn't experiencing any pain that would need me to take painkillers. The scar and the dressing all resolved itself perfectly fine, so I didn't have any issues there. And internally, I didn't feel, I always thought that I would feel different, and that I would feel that there was some sort of metal prosthetic in my hip joint, but I didn't. It just felt like my hip had been restored. I didn't feel that there was something inside that hadn't been there before. It just felt like somehow my hip had recovered. But saying that, I did feel that it was weak and I needed to rehabilitate it. I did feel for a while that I needed the support of crutches, for example. I did feel that I couldn't push it too far in certain directions. So you know, there were these issues about it. Maybe they were just psychological more than physical, but you know, I was wary of not doing anything that would make it dislocate. But at no point did I feel that it was even close to, you know, dislocating or coming out of the joint or whatever. And I felt pretty sort of soon that I could get up and down from chairs in the way that I was shown by the physio, and could walk around quite easily, albeit with the aid of crutches. I gave up fully on using even one crutch after about 3 weeks maybe. So, you know, from 3 weeks onwards, maybe 4 weeks, you know, I've just been walking with no crutch, just sort of, you know, getting my strength back and so on. Yeah, I hope that has been useful to everybody, and I would sincerely recommend, if you are feeling that you have a hip joint or any other joint issue that is impairing your life or your quality of life, I would recommend, well, seriously recommend considering, at least considering going for surgery.